is Nigeria Info.
Nigeria Info.
This is Nigeria Info.
Your questions there as well. Dr. Felix Magnus, a consultant urologist, is taking on the conversation around infertility in men. And just to be clear, Dr. Magnus, you are a consultant urologist. I always like to be sure that you can take on all manners of questions on infertility, because I have one here about someone asking you to clarify on menstrual cycle and all of that. Is that also within your scope?
Well, not necessarily. The gynecologist would have done some good jobs on that.
Okay.
I was only just digressing to explain why, for a man, once you see any, thing that doesn't look normal around your penis, you should always come to the hospital to seek for clarifications rather than just assuming. Because what I was saying was the story of the lady,
yes,
or the man that got married to a lady, and on the wedding they now discovered that there was no opening. The opening was just top shot. It wasn't through, so mean that they couldn't have sex.
Wow.
And on further questioning, it was found out that she's not been menstruating all this while because she never really had a vagina. She had a peculiar condition in which, even the uterus wasn't formed in the first place. She was more or less like a man who, the receptors for the male hormone was not found, so that the external genitalia, the penis and the external genitals now look like a woman. But actually, when they checked her, she was actually a man. But why she had things like breasts and other things. I'm just saying that, so it means even for a man, just like it can happen for a woman, once you notice anything that is not normal, either maybe your scrotum, you can't find your testis in your scrotum, you should know that there's a problem. You don't need to wait until you're married. You need to come and find out, why am I not having testis in my scrotum? Or maybe you see that the shape of your penis is not looking normal, or when you want to urinate, instead of urine coming out at the tip of the penis, it's coming from under. That may suggest some problem with fertility, because it means when sperm wants to come out, it may not be able to come out at the tip, so that you can't introduce it properly into the vagina. So it means when you're having sex, most of the sperm will be falling on the ground instead of entering the vagina. So that may pose a challenge for fertility. And that's the condition we know, and we call it hypospadias. I don't want to bore you with most of the technical terms. I'm saying that, once you notice anything, or maybe the penis is, urine is not coming out from the right place, or for instance, the way I said, somebody, maybe following lifestyle, adjustments, maybe you're getting too obese, you now notice that your breast is looking like that of a woman. Sometimes you see some men whose breasts are almost like that of a woman. That suggests that's some form of obesity, and it may also suggest that you have a lot of female hormones in your body, and the male hormone may not be enough for you to have good fertility potential. So these are some of the things that may tell that there's a problem with fertility in this person. I'm just trying to answer that question. That are there things you see, but yes, there are things you will see. Yes, that should make you to know that, see, I think I need to get a clarification from a urologist to know if I'm fertile or not.
Okay.
And when you come, we'll check your sperm count, do some other thing. Even sometimes for some men, everything may be fine, but it's just that you now notice over time that, you're feeling like there are some bag of worms in your scrotum around your testes. Bag of worms, yes. That is a condition we call varicocele. Varicocele means that the veins that supplies, or rather that drains the testes, is getting bigger than normal, what we call dilated.
Okay.
It's getting longer and twisted. So if that happens and you don't take care of it, over time it can result in reduction in the size of the testes. It can affect sperm production, and it can also cause some pain later. So what we're saying is that anything you notice that is not very good around your penis, your scrotum, you should actually come to seek for help and not assume, because we've had patients, just like I said, this 48-year-old man, if not for the fact that somebody came back from the US and became concerned, and I said, no, this boy, I think you should go to the hospital. Don't assume, because for him, they just encouraged him that that's possibly the way God created him. There's nothing wrong with him. He shouldn't even bother asking questions. Rather, he should give himself to the service of God. So he is currently serving, like, more or less he's serving in church and all that things. I'm not saying that, but this person dragged into the hospital, and now we're beginning to discover that he was born with a peculiar condition called what we call epispadias, bladder atrophy epispadias complex. That means that the bladder was not closed properly when he was born, so meaning that the bladder was exposed to the atmosphere when he was born, and also the penis, the opening of the penis is located on the upper part instead of on the tip of the penis, and so many other things that he had, which means fertility will be a challenge, just like urination was a challenge for him before we did some correction. So I'm saying that there are a lot of things like that. So once you notice them, don't assume they are normal. You should come and ask questions so that you can actually get help early.
I hear you, and there are a few other questions here that you may need to address before we let you go. But just to say to Daniel's question, he was very clear. He says, you can look at your body and you can tell. I guess maybe by virtue of society and sometimes this thing about men not really being open to have certain conversations, except, in very, very close, small circles. I don't know. This is just me saying, because I've heard men say, talk about some kinds of things that they can and cannot talk about amongst themselves. So, it could be that this person is really viewing his body as something that is normal. So how they will educate women, for example, on how to check for breast cancer, for lumps in the breast. Some guy might be feeling up on himself and not knowing that what he's feeling is not normal. So perhaps is there education or awareness around what the average testis is supposed to feel like, or do we just assume that every man knows that, okay, I can't feel how did you put it, the testis in my scrotum or the scrotum in my testis? I'm not sure which one it is, but you said
the testis in my scrotum.
The testis in my scrotum. Yes.
That's your balls. Yeah.
Okay, so is there like educational awareness, or is every man just supposed to know what it feels like and know that, okay, something is not right about the way it feels, and then you can go? Because if you don't check, because again, Daniel says, looking at your body or feeling up on your body or something, how would you know, right? As opposed to just thinking that, every man knows. I don't know if there's awareness or education in that area, or am I the one who's being naive and not knowing that men just know these things? I don't know.
No, actually, there are awareness. Like, for instance, what we're doing currently is a form of awareness. anybody who is listening to us should know that, you should check. And if there's something that you're not sure of, even if you think it's normal, you should just come to the hospital.
Okay.
And there are other forms of awareness, both, on media, even in church. Yes. Like, for instance, some of the persons, like some children who, we've attended to, for instance, especially the common one we call hypospadias, where, urine is not coming out from the tip of the penis, it's rather coming out from under. Where when they are urinating, urine will be coming out from. Some of them were in church. Somebody came to give an awareness and said that for a man, urine is meant to come out from the tip of the penis. It's not meant to come out from under. So that's when they now say somebody told them like that in church. So they decided to come to the hospital to find out, because notice that since the child was born, urine has been coming out from under. So there are a lot of awareness, yes, to some extent, but we need to do more, of course.
Okay.
Yes, just like some persons may not even be aware. I mean, we've seen them, some people in their 50s, that's when they discovered, or they began to come to the hospital, because all the while they were born, they only had one ball in their scrotum. So even though they knew that comparable to their siblings, that this is not exactly the way their elder siblings or the boys around them are, but they felt there was not.
Oh dear. Okay, let's bring Dr. Magnus back in very quickly. Again, talking about how to identify as a man signs that you can maybe use to determine or know if you are fertile or infertile. And I have to move on very quickly to another question that came in here on the one about menstrual period and all of that. I mean, I don't know. Someone says he should shed light on menstruation, period, ovulation, window, and menstrual cycle. He has said that it's not exactly within his scope, but would leave it to when Adiola Olunoya comes back on. I think she may be able to speak more on that one. We also had Dr. Ogunkile, the gynecologist, also, who may be able to speak to that one. But let's Dr. Felix. Yeah, if you could just round up that thought very quickly so that I can move on to the other question, and I have the phone line buzzing for you so that we can take on as many as we can in the next few minutes that we have.
Okay. So just like I said, people have, but they came to the hospital. So there's some awareness ongoing. Okay. This program is an awareness. Okay. People should increase their, antennas in hearing things that are happening, so that when you notice anything that is not very okay, and ideally, we should have some form of annual checkups, or rather, just because of, some of the policies. That's why governmental policies are also very important, because if people have regular checks, like annual checkups for your entire family, you just take everybody to the hospital to check and be sure they are all fine. Some of these things could be discovered even without you knowing. Even some of the things that you may not really feel is a problem, we will tell them, no, this is a problem. So we're saying that the obvious things you can see on somebody's body that may suggest there will be a problem later: breast enlargement for a man. The man's breast is not meant to be big. Once there's a breast enlargement in a man, you have to want to know why. Would this suggest some problem with fertility? Or the penis is too small? Sometimes some children are born and the penis is so small, in fact, like what we call micro penis. That may suggest a problem later. Then also abnormal openings of the penis, under instead of at the tip. Just like we say, absence of balls in the scrotum. Any of those things may suggest there's an obvious problem, so that, you don't need to wait until you're ready to have children to begin to find answers to those questions.
All right. A question from Phil from Gwarimpai says, good evening, doctor. Can normal sperm count and 5% motility lead to pregnancy?
Oh, very good question. Yes, this person possibly has even gone further than where we are now. Normal sperm count and 5% motility. Well, by definition, just like we said, pregnancy is the only sure test for fertility. Yes, meaning that we've seen pregnancy happening at any parameter, but for convenience of diagnosis and management, a 5% motility is too small.
What is a 5% motility? Let's start from there.
Okay, that's fine. Okay, I thought since this person was already on the higher pedestal, we should stay there.
No, let's all come on board.
Let's all go to the pedestal.
Yes.
Okay, it's very important.
Okay.
Yes, motility. Okay, yes. When sperm is produced in a man, there are certain things we look out for. First, it's not enough that you have sperm. We also want to know, can this sperm swim? Because usually when the sperm is deposited at the time of sex in the vagina, it's meant to swim through the cervix, uterus, goes to the fallopian tube, the tubes of the woman is where the eggs usually are released into, and that is where fertilization or the egg and the sperm meets usually. So it means from the place where the sperm is deposited at the time of sex, which is usually in the vagina, the sperm should be able to move, what we call swim. Sperms are meant to swim. So if the sperm is not able to, that ability to swim is called motility. Like motor movement, So when we talk about motility, we are saying that the ability of the sperm to move. Because if the sperm cannot swim, it means fertilization may not happen, even though the quantity is enough.
Okay.
Meaning that if it's deposited in the vagina, it will remain there. But the eggs will not come to the vagina. They usually stay in the tubes. I don't know if you're getting. So
Yes.
that is why motility is very important. In fact, it's one of the most important parameter for every sperm, the motility. So that, just like I said, even at 5% motility, sometimes we've seen pregnancy happening, but that is not the usual. Many times you need at least 40% overall motility, meaning that at least it should be up to 40%, meaning that out of the entire sperm release, 40 out of 100 of them should be able to swim effectively. That's what I was saying, or what we call 32% progressive motility, meaning that overall, 40 out of all the sperm release should be able to swim. Then out of these 40, 32% of them should be able to be progressive, meaning that they should be very active. So that is what we now regard as normal, meaning that in that case, we expect pregnancy. But just like I always say, we don't miss that fact that the only short test of fertility is pregnancy. So meaning that, if somebody has 5% motility and has achieved pregnancy, we will not say it's not correct, because it's possible, but it's not the normal.
Okay.
For somebody who wants to achieve pregnancy with a normal sperm count, we expect at least 40% overall motility and 32% progressive motility. And motility means the ability of the sperm to swim to where the egg is. There are other parameters in the sperm which I don't know if we have time to talk about, or maybe we should just answer the questions on ground first.
So far, I think for the messages, we're done with the messages. But like I said, the phone lines were ringing earlier on. So let's perhaps give people the opportunity to call in and speak to you as well. Okay, so 07 00951 0000 or 00959748669. You can also call in on WhatsApp. It's 0809-993-0137. Hello, good evening.
Hello, ma.
Yes, good evening.
Please, Marie, she's from Kubwa.
Welcome.
When someone is having an affair, after having an affair, you feel so bad.
I'm sorry, your line is not very clear. Ask the question again.
Like when someone is having, I'm the person that have that challenge. When I'm having sex, I always feel bad.
When you're having sex, you feel bad?
Yes, I feel bad. I don't feel like I don't feel like woman. So.
Are you married?
No.
Okay. So you're feeling bad. Is it a physical pain or something in your body? Or is it your mind that is just telling you this thing you are doing, you're not supposed to be doing it? Which one?
I can't just tell, but I don't always feel like wow, people always ask me that, are you sure that you're a woman or a man?
Okay. Well, I mean...
There's something else to ask.
Okay.
That most drugs that someone can take flush someone's system.
If I heard you correctly, you're asking what medication can one take to flush the system?
Yes.
As in detoxify?
Take it from the blood, yes.
Okay. I would just allow the doctor, if at all. But just to be clear, the first question you asked, when you say you feel bad, it's not that your body is feeling bad. It's a mental state, yes. Right?
Yes.
Okay, all right. I just needed to be clear on that one. Okay. Doctor, 2 questions. I don't know if really they are for you, because they don't really seem on topic. But let's have you take on them anyways. Or let me gather all the questions. I'll come back to you. Hello?
Hello?
Yes, good evening.
Good evening, ma'am.
Welcome to the show.
Thank you, ma'am.
You have a question for Dr. Felix?
Ma'am?
Do you have a question for the doctor?
Yes, I have a little question for you.
All right, go ahead.
Please, I want to find out someone that has never had sex before, or like for long, like has never done it before, from childbirth to up to 30. Is it that like will it cause any harmful distance to the body, or will it cause problem? That is what I want to know.
Okay.
And also, some people also used to tell me that because sometimes some people want to ask me that have you asked it? I will say no, and they will say this kind of thing that you have not done it before. If you have a wife, it is so. I want more clarification so that I will know my stand.
Okay.
So I know how to answer some questions and what I can say.
All right. This person is a virgin and they want to know if their virgin status will affect their fertility. That's what I got from that one. The first person who called says they feel bad when they're having sex, and I investigated, if you will, to determine if it was a physical pain or physical sense that was making them feel bad, or if it was a mental thing. And I think that one is a mental thing. The person is not married, so I think it's a question of morality there. The second question, what was the second one again? Oh dear, I've lost track. Feel free to call back if that was you. But they to me, the questions I would allow you to determine if they are questions for you as a urologist.
The person talks about detoxify, flushing the system.
God bless you. You heard it. What are the medication that they can take? I don't know if that ties into our conversation, but yes, by all means, let's hear from you.
Okay, that's fine. Yes. Let's start with the virgin status. Yes. The virgin status does not have any negative effect on fertility. Yes, so to say. I think that's just the answer to the question. I mean, being a virgin, that is actually how it should be. Being a virgin is what you should. Then when you're ready, then you go ahead. But of course, also not being a virgin, what will mean that being a virgin, not being a virgin it doesn't affect your fertility in any way. That's what we're saying.
What determines it is, have you checked yourself to be sure that everything is in the working order? Okay.
You're a virgin, you should be having your menstrual flow normally.
Oh, this person is a guy. The person who asked
is a guy. Okay, this person is a guy. So have you checked yourself in terms of, your penis, everything looks normal, your balls are there, you're not having difficulty in passing urine is coming out at the appropriate place, you're not having breasts like that of a woman, you're not having any of those challenges. So that's what I'm saying.
Okay.
Once you've checked yourself and you look okay, then that's fine. There's no need to worry. Then talking about the other person who said
they feel bad and asking for how to flush out the system.
Flush out everything. Yes. First, if what you're doing makes you feel bad, I think it's only wise to stop that, because, sometimes this may just be psychological, just like, Somi, you said, maybe things that bother some morality, maybe either because of your upbringing, as well as the things you have been taught over time. So that possibly, you may not be doing what is expected of you. So that's why you're having some bad feeling. Ordinarily, that shouldn't be, you shouldn't be feeling bad. So it's something maybe you just need some counseling. Maybe you can come for some form of counseling, as well as, we'll counsel you and other things that may help. Then talking about, are there things you take to detoxify your system? It also depends on what you mean detoxify your system. What are you detoxifying your system from? What actually entered your system that is considered toxic? Is it the food, the drink, or is it the act of sex that is the toxin? Because detoxify means you're trying to remove toxins from your body. So it all depends on what has caused this toxin, or rather, what is this toxin that's entered the body? That is what determines what you call detox.
Okay.
But of course, generally, fruits and vegetables, which are powerful antioxidants, are good for the body because they help in relieving stress from the body. They help in ensuring that the body doesn't get too stressed. and also the damaging effect of stress on the body is made better when you take a lot of those fruits and vegetables, what we call, they are powerful antioxidants. Yes. So I think that's just something I'll say at this point. But you need to first identify, what are you detoxing from? What are you trying to detox? That will now determine exactly what you do.
Okay. All right. It's 11:23. In another minute or so, I have a commercial break to go on. Dr. Felix, perhaps we will have a conversation offline about whether you want to continue for maybe another 5 minutes or so, seeing as we didn't really start on the mark, or we move it till next week, whichever is more comfortable for you, because the phone lines are still buzzing. So it looks like you might still have some questions to answer. So do you want to come back for another 5 minutes after the commercial break, and then we'll wrap it up then?
That's fine.
Okay.
That's fine.
All right then. Okay, Dr. Felix has graciously given us just a little more time. So let me see if I can quickly take this call, and then after the break you will answer it. Hello, good evening. If it's a question for him.
Calling back.
Okay.
And the reason I was asking is just that I went to hospital to run a test, malaria and typhoid test. After taking my blood, and my blood was very dark. I was asking, because sometimes anytime I have injury, my blood is very, very dark. I was asked, what is the cause of all those things?
Okay.
Why my blood is very black and dark like that?
Okay. That's why you're asking about what to take to flush it out, yes? Okay. Hello, good evening.
Hello, good evening.
Yes, you have 30 seconds. Please make it quick.
Yes, you're talking with QB from Central Area.
All right, go ahead.
Okay, like 3 weeks ago, the consultant talked about a scenario where if a man have sex with a lady, he have all these fever feelings, malaria, and so forth. So I lost track. I didn't hear what causes that and so forth. I don't know whether you can help us and
all right.
about what causes that and so forth.
Okay, all right. We'll get back to that after this break. Stay with us.
Talk news and sports station. This is Nigeria Info.
This is Nigeria Info. This